My name is Zami Tinashe Hemingway. My pronouns are Zami, he, and him, and I am the Capacity Building Assistance Gender Affirming Care Manager with Denver Prevention Training Center. Gender affirming care is whole person care. It is care that focuses on the needs of the individual, regardless of gender identity, race, ethnicity, sexual orientation, and socioeconomic status. It is care that says you are deserving of being treated with dignity and respect when you're receiving medical services, no matter who you are or where you are. Gender affirming care is important to me because as a Black person, as a Black transgender and queer person, I know that nearly 50% of transgender people of color go without seeking medical care because of fear of discrimination, harassment, and other forms of mistreatment. And because of this, that means that more of my transgender, non binary, and gender expansive siblings are more likely to be living with untreated chronic illness and disabilities and with a higher morbidity rate, which can be prevented if they had access to the gender affirming services they deserve and truly need. One thing that I feel is most important when supporting the health and wellness of the transgender non binary community is to remember that we are your children, your siblings, your teachers, colleagues, ministers, and healthcare providers. The most important thing when supporting us is remember that you are supporting a person, a human being, not a statistic. You're supporting your friend, neighbor, and family member's ability to live a life free of harm, discrimination, and optimize well being. Holistic Gender Affirming Program is a program that focuses on providing services and care to address and combat the social determinants of health that lead to higher rates of comorbidities and infectious disease diagnosis amongst transgender and non binary community members. A holistic gender affirming program doesn't just focus on sexual risk assessments or PrEP interventions, but focuses on the professional development of transgender and non binary people. It focuses on teaching our community how to experience joy and pleasure, teaches us about financial literacy, nutrition, advocacy, and everything we need to not only optimize our health potential, but move from survivorship to thriving in a world where we are consistently being attacked. A holistic gender affirming program is about creating equitable resources and investing in the advancement of gender affirming care and support of transgender and non binary communities so that we are no longer impacted by social determinants of health and can increase our health potential overall. Social determinants of health are larger systemic forces in our lives that impact our health outcomes. This includes education access and quality, healthcare access and quality, economic stability, social and community context, as well as neighborhood and built environment. Social determinants of health impact transgender and non binary community members because we know that the unemployment rate for transgender and non binary people is almost 3 times the unemployment rate of the US population. We know that the poverty rate is almost 3 times that of the US population as well. And that the number one reason this is because of the societal sanctioning and acceptance of transphobia and anti trans discrimination. What understanding social determinants of health does for us is help us shine a light on the social political context that impacts the health and well being of not just transgender and non binary people, but all communities that are marginalized. When we are able to address the social determinants of health for the transgender and non binary community, we're able to address the social determinants of health for women and films of color, for disabled people, for homeless veterans, for anyone pushed furthest to the margins.
Name is Miss Jai. I use she, her, and he, him pronouns, and I'm an identity consultant for Denver PTC on transgender and non binary health and wellness. Social determinants of health are the conditions in our lives that impact our ability to live a healthful life. They fall into 5 categories. So it's economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community contexts. For trans and non binary people, the social determinants of health can impact our health outcomes, some directly. For example, experiencing discrimination at a health center and therefore not getting our health needs met or avoiding health services in the future. Or they can impact our health indirectly, like being denied employment or opportunities for advancement at our job, leading to economic instability or maybe not being able to afford our cost of living, therefore, resulting in delaying of our health care because of the cost of health care, living in housing or neighborhoods that have more environmental health hazards, or not being able to afford healthy and nutritious food. And we see that trans and non binary people experience more negative social determinants of health compared to cisgender people in all of those spheres, resulting in poorer health outcomes for our mental health, for our physical health, for chronic health conditions, and for our ability to live a healthful life. Gender affirming care is care that is client centered, patient centered, trauma informed, and respects the self determination of a person's gender identity. Gender affirming care is also care that helps to align an individual's outward physical traits with their gender identity. So we see gender affirming care both as a way that we treat clients and patients who come into our spaces, but also specifically focusing on the medical transition aspects. So it just depends on how you define it in the organization. Gender affirming care is important because we see barriers to care for trans and non binary people at the provider level, meaning that we experience discrimination and transphobia, including intentional and unintentional misgendering or using an incorrect name, assumptions about our bodies or how they function, and curiosity or objectification about our bodies from providers. So, because we are experiencing these barriers to care, trans and non binary people are more likely to avoid care unless it's an emergency or an urgent condition. We're less likely to get preventative care. We're less likely to get care that is culturally responsive to our needs and is applicable to our health and the ways that we move through the world. And so, gender affirming care is important because from the first definition, gender affirming care is important because it ensures that we are providing services that are appropriate, that do not traumatize or re-traumatize an individual who's coming to see us for care, and it enables patients to feel fully affirmed in the identity when we are getting care, in our identity when we are getting care. Additionally, it's important because gender affirming care that aligns our outward appearance with our gender identity helps to reduce psychological distress that we might experience from gender dysphoria, and it helps us to feel more affirmed and more whole in our identity and reduces suicidality, suicidal ideation, as well as depression, anxiety, and stress that we experience from experiencing incongruity around our gender identity and the way that our bodies are actually put together. As a trans and non-binary person, I'm actively trying to get my healthcare needs met. And so it's important for me to be able to talk about gender affirming care because it lets me know whether or not the person I'm going to be getting services from is a safe person to talk to, whether or not they are going to be willing to talk about gender identity as it relates to my health or as it doesn't relate to my health, and that who are providing gender affirming care are usually a little bit more savvy around the social determinants of health and how those are going to impact my ability to navigate the world, my ability to get my medications, my ability to get emergency services that are culturally responsive to me. So it's important to me that gender affirming care is made available because at its baseline, it provides the opportunity for me to engage in a way that feels whole and affirming with providers, regardless of what I'm seeing the provider for. And at the level of health for ourselves, it helps to reduce the severe psychological distress that we experience while trying to navigate a world that is not built for trans and non-binary people to live and thrive in.